here's the situation. We have done all this work in our preclinical systems, and then we modified the approach for people. And I've published many case reports on individuals that should have been dead, were given terminal diagnoses, and they're all doing very, very well. They have a high quality of life. And I'm not saying they're cured. All I'm saying, maybe some are, maybe some of these people are, but there's others that are not, but their tumor is now indolent. It doesn't grow, and their quality of life is good, but they still have this tumor in their body, but it's no longer considered a terminal kind of situation. Maggie and Brad Jones are almost through with their big documentary on the cancer revolution, which shows that cancer is primarily a metabolic disease. And they have been collecting numerous folks who are supposedly terminal cancer patients that are all alive with all different kinds of cancers: lung cancer, colon cancer, breast cancer, brain cancer, all the different kinds of cancers that were all given terminal diagnoses, and they're all still alive. And you can go to their website and see interviews with all of these different patients. And I keep sending them more and more people who email me telling me that they were supposed to be dead and now they're alive. And what I tell them is go to Brad and Maggie, they will interview you, and then you can tell the world what you did and how you did it to manage your cancer. How many people will it take before the world recognizes that this is the way to manage cancer? A stumbling block is the people say, well, we can't believe it. We can't believe that these people are real until we do a big clinical trial on your therapy. The problem is most of the people who won't believe it have no clue about the problem. They don't understand the biology of cancer. And if they try, some folks have tried to do clinical trials, and they do it in the absolute wrong way with no knowledge about how to. This is a new medical treatment strategy. Training is involved. You have to be knowledgeable to do a trial. And besides, the strategy of clinical trials for metabolic therapy is completely different than the trials for some drug produced by the pharmaceutical industry. Each person must be viewed as a separate entity. The person is their own control. So we have to go on their status. If you're diagnosed with cancer and you have quantitative evidence for where the tumor is and what kind of tumor it might be, then metabolic therapy will be used to either eliminate that completely or bring it into a dormant state based on you and how you respond to that, not based on some thousands of people, dumped into some trial, all treated the same way by unknowledgeable people. And therefore, you're not going to get the outcome that you would have expected. So it's an educational mission. People have to learn. Like you said, how is it possible that you go to oncology clinics and they're giving sugar drinks to cancer patients? And these guys now will run a clinical trial on metabolic therapy while they're feeding their cancer patients sugar. This makes no sense. So again, you have to have the knowledge basis for this. I have one colleague from Norway who had some sort of a skin cancer, and he was able. He had a big. I was invited to Oslo to give a lecture there, and he was telling me that he could actually watch his tumor grow and shrink depending upon his blood sugar, about the blood sugar in his body. So when we're interested in killing tumor cells, we have to simultaneously hit both of the fuels simultaneously. And this is where drugs and diets are used in a cocktail that will selectively remove both glucose and glutamine while transitioning the entire body to nutritional ketosis. People need to know human physiology. People need to know basic biology. People need to know evolutionary biology. So it's an educational mission. But I'll tell you, when you know what to do and how to do it, it works.